Kigera, and I'm affiliated to University of Nairobi. So the coronary sinus is used to deliver the blood that is circulating in the heart to the right atrium. So the coronary sinus is increasingly being used for interventional cardiovascular procedures such as lead placement when you're having arrhythmias, and there is increased invasive cardiac procedures that ideally use coronary sinus for catheterization and cannulation. And due to that, now there is need to study the normal anatomy of the coronary sinus and the valve that is found on the opening. So the valve that you're talking about now is a Thebesian valve. And when it's Thebesian valve, which has various morphologies, if it's not well understood, it can lead to occlusion of this coronary sinus. And due to that, we need to study the variations of it. And also we need to know the angle that you need to use so that you can easily cannulate the coronary sinus. So there are limited studies that are done in the Black African population showing its prevalence and the sex structural differences between males and females. And that's the aim of the study, to investigate the prevalence and the sex-related structural differences in the Thebesian valve. And so in our study, we examined 100 heart specimens. The median heart weight was 289 in males and 284 in females. And the valve was prevalent in 73% of the hearts. It varied in terms of its morphology, and in some hearts that we examined, we found that the valve was absent, and also the valve being absent correlated to a larger coronary sinus opening. The percentage occlusion, of course, was high in males and females, and we'll see the reason why we have that. Also, there were positive correlations between gross heart parameters and coronary sinus dimensions. So this might try to show that there might be potential utility in the during interventional cardiovascular procedure planning, so that we know the morphologies of the Thebesian valve. So this valve has variant morphologies, which we'll see in a few minutes. So for the introduction, as you can see here, this is a coronary sinus. So the coronary sinus opens on the right atrium, and on the opening of this coronary sinus, on the east side part of the right atrium, we have the Thebesian valve. This Thebesian valve prevents retrograde blood flow into the coronary sinus during atrial systole. So the morphological variances and the structural now uniqueness of this valve, notably in the Black African population, like is understudied, is underexplored. And it has been noted that sex-related alterations such as fibrosis, calcium deposition, ideally might affect the function of this valve and might impair the coronary sinus catheterization during the cardiovascular procedures that you're talking about. So it has also been documented by Mark et al., who noted that the Bayesian valve might lead to 5 to 12% failure rates of transvenous left ventricular lead placement when you have this obstructive Bayesian valve. And that's the reason why we studied the morphologies of this valve. So the background of the study, as you can see in this image, this is a coronary sinus opening, and this is a Bayesian valve. So this is a Bayesian valve. For example, this is a semilunar morphology of it. Sometimes we'll have other morphologies that we'll see. So just imagine if you're having this Bayesian valve covering the whole of this coronary sinus opening, and you want to use the coronary sinus to catheterize the heart. Maybe you want to do left ventricular lead placement, and you can't be able to do that because of this obstructive Thebesian valve. So It's a remnant of the sinoatrial valve found on the opening of the coronary sinus, as we noted, and its function is to prevent retrograde blood flow. It has various morphologies, and here we go to the aims and objectives of the study. So the aim of the study was to determine the prevalence and sex-related structural differences of the Thebesian valve in Kenyan population. The objectives were three. The first one was to describe the prevalence and morphologies. The second one was to determine the sex-related structural differences. And the third one was to determine the correlation between the length of the coronary sinus with coronary sinus opening diameter. Research question, of course, was what is the prevalence and sex-related structural differences of the Thebesian valve in a select Kenyan population? The null hypothesis is that the Thebesian valve has structural differences, which is associated with sex. Of course, that's an alternate hypothesis. The null hypothesis should be the Thebesian valve has no structural differences associated with sex. For the literature review, of course, we know the coronary sinus drains venous blood from the coronary circulation into the heart. And that is what has been noted, that the coronary sinus provide access in cardiovascular procedures, as we noted, and it resembles the eustachian valve in fetal life. So this coronary sinus is critical in left ventricular lead placement for resynchronization therapy, and the failure rate during when you're having this obstructive Thebesian valve has been noted there. So the Thebesian valve has various morphologies, which we'll see in a few minutes. A larger obstructive valves may impede coronary sinus cannulation. And as we noted earlier, fibrosis and calcification might affect the mechanism of this valve, and structural differences between males and females may affect catheterization outcomes. And that's the reason why we need to study the coronary sinus morphologies in Black African population. For the method and study design, it was an autopsy study, and the study design was descriptive cross-sectional study. We stratified the specimen into age groups and selected using systematic random sampling. Then we did a Y-shaped incision on the thorax where the sternum was removed, and then we removed the heart from the base of the great vessels. And then after that, the heart were measured using an electronic weighing balance. The height of the hearts were measured, the width, and then the right atrium was opened using an initiation from the superior vena cava to inferior vena cava to expose the Thebesian valve, where now the coronary sinus opening and the Thebesian valve were inspected. Images were taken in anatomical position, and the valves were classified into various morphologies. For the sampling technique, we used random stratified sampling. Inclusion criteria was hearts from males and females. And then exclusion criteria was that any heart that had heart surgery or had heart grafts was excluded. Cardiac pathologies and hearts that had been retained for more than 48 hours were excluded. Also, more information was acquired from the pathologist who was in charge. For the data collection, all the values were standardized using the heart rate of the specimen. After that, the data was coded, the morphometric data was loaded into SPSS, and then data was analyzed. Normality of the data was, of course, tested using called Morgan's Prof test. And then the data, which was normal, which was not really distributed, was analyzed using median and interquartile ranges, while morphometric results were statistically analyzed for independent variables. Quiz-Kangwalis was used to compare structural differences of the Thebesian valves. Man-Whitney test was used to compare structural differences of the Thebesian valve. And then Spearman rank correlation test was used to check the parameters of the heart with the diameter of the coronary sinus. So what were the results of the study? So in our study, out of 100 hearts, 63 were males, 7 were females. We talked about the median age of the hearts being 37, ranging from the age of 17 to 88 years. The interquartile range was 28 to 49 years. The median weight of the hearts was 289 in males and 284 in females. And that has been noted according to the various age strata that we divided. As you can see in the table shown there. So the patient valve was absent in 27% of the hearts that were examined, and 73% of the hearts that had the patient valve, 16.4% had valves covering 75% of the coronary sinus ostium. So you can tell if the coronary sinus is being covered by over 75, you need to study the patient valve well, its morphology well. And then you can see this is a sample of coronary sinus opening that didn't have a patient valve. So the patient valve morphologies varied with sublunar being the most common. We'll see the morphologies in a few minutes. The sublunar valves presented were 57.5% of the cases. Fused valves carried 6.8, cord strand 12.3, and a unique Y-shaped valve was observed, which was classified as a fused strand. So, for example, these are Y-shaped valve that was seen. The second vaccines of a Y-shaped Thebesian valve, as you can see there. And it was classified under fused strand subtype. Then the heart morphometric measurements were nearly identical across all sexes, that is, males and females. And the patient valve occlusion rate was higher in males than in females. So here are the morphologies that we noted. The first one that you can see here is a scapular segmental valve, and a division of it was being shown here. Then we had a remnant of the patient valve. You can see it here. There is a fused strand. It's a fused strand.
So sorry, Kimani, can you just clarify more?
Okay,
I
I'm seeing my
mean
timing.
on the voice and also the timing. Yeah, yeah.
Yes, actually, I'm seeing my time is almost is over. That's the reason I'm trying to rush. But let me clarify. So the patient valve has various morphologies, 5 morphologies ideally. In our study, we found 5 morphologies also. We found that we had a membranous type of morphology, as you can see here. These are membranous type of the Thebesian valve. Then we have a remnant type of the Thebesian valve. We had a fused type of the Thebesian valve. You can see now
There is noise on there is background noise on you. If you are using a mic, maybe you can just put off the mic and speak.
okay. Okay, no worries.
Now it's better. And
Okay, what about right now?
yes.
Okay, that's okay then. So I was talking about we are here in the fused strand type of Thebesian valve. So it's covering almost the whole coronary sinus, but it's fused. Then we have a fenestrated type. As you can see, this is the real image, and then the rim of the valve is here. Then the cord strand is just a strand that is covering the coronary sinus, as you can see there. So those are the 5 morphologies of the Thebesian valve that we noted. So what is the difference now between our study and other studies? The difference between our study and other studies is that the presentation and the prevalences of these morphologies was different in our study than in other studies. And so we get to our discussion where we noted that we have the Thebesian valve, which can potentially occlude the coronary sinus opening. According to a study done by Wang et al., it showed that the Thebesian valves were present in 73%, and it was examined, and it showed that this Thebesian valve varied in terms of the various morphologies. According to Sanji et al., which was a study done in 2024, showed that two fenestrated valves were covering almost 75%, more than 75% of the coronary sinus ostium, but still cannulation was present. It was able to be done, but imaging was needed in that kind of study. According to a study done by Gami et al., Ann et al., and Ghosh et al., showed that 60.4%, more than 60.4% of the valves were potentially complicating, given that they had valves that were covering more than 75% of the coronary sinus opening. So such valves may require imaging, and if imaging is not present, it might lead to coronary sinus injury, which might lead to bleeding. So literature shows that 65% to 95% of the valves are present. This is according to studies done by Ghosh et al., Holder et al., and even Sluia et al. Various classifications have been identified, as we saw in our results section. And in our study, we noted that various valve morphologies, for example, now if we have a fibrous type of fibrous stroke fenestrated type of morphology, or if we have a fenestrated type of morphology, it can easily obstruct. This has been noted in studies such as done by Fele et al. So endoscope visualization may aid this catheterization process. But there was a Turkish study that was done by Keraka et al. Showed that 8% of the valves were named as first of cannulation, which is kind of differing from what we saw as 15% of the hearts being referred to as first of cannulation. Study done by Silva et al., Silva and Rowe et al. Documented that 12% of the valves covered more than 75% of the coronary sinus ostium. In our study, we found that there were no significant sex differences, which is in line with a study done by Verena et al. However, in males, there was more greater percentage occlusion than in females, which was likely due to the valve height differences, which has also been noted by Mathias et al. To wrap it
So
up, is that heart weight?
the presentation is very nice and a wonderful paper, but for the interest of time, I am about to stop you here and give I mean the attendees to ask question if they do have, because we're taking much of the time. So you can either go live and ask your questions, or just put the questions in the chat box for Kimani and for the study team. So thank you, Kimani and colleagues.